It's a beautiful day. Lucky that we live Hawaii. 24/7, 365. Swimming in the ocean anytime. Take a leap, live healthy. Eat well. A, be active. P, live mono every day.
East side, take a little bike ride. West side.
Aloha kākou and welcome. My name is Lauren Eleni Gill and I'm with the Communications Office at the Department of Health. I'll be your host for this episode of Foundations for Healthy Generations, a program for and about public health in Hawaii. Each month we invite you and your family to join us as we discuss public health programs, initiatives, and concerns. In this episode, we'll be talking about an exciting and innovative approach to healthcare for adults with severe mental illness. We're talking about the Living Well Hawaii Project. Our special guests today are Dr. Tamoria, the Medical Director for Kalihi Palama Health Center, and Ms. Kimberly Fuke, the Center Manager for Kalihi Palama Community Mental Health Center. Welcome and thank you so much for joining us today.
Thank you for having us.
Well, I know that the Living Well Hawaii Project is relatively new, but both of you must have extensive backgrounds in the public health field. Do you mind introducing yourself and telling us how you became involved with the Living Well Hawaii Project? Kim,
Sure.
let's hear from you first.
I'm a licensed clinical social worker and I received my degree from the University of Washington in Seattle. For the last 15 years or so, I've been working in a variety of health and mental health environments, ranging from skilled nursing facilities in Washington State to inpatient and outpatient psychiatric facilities in Connecticut. Finally, I was able to come back home to Hawaii, and for the last 6 years, I've been the center manager of the Kalihi Palama Community Mental Health Center. The Mental Health Center serves about 300 severe and persistent mentally ill adults. And these are individuals who have diagnosis of like schizophrenia, bipolar disorder. They need assistance in a whole range of areas. And it was, over the last several years as the center manager, it's been very heartbreaking to see individuals, our clients, die of preventable illnesses when they're in their 40s and 50s. It's very sad. And you always think about how if they had access to proper medical care, would have that changed the outcome? And a project like this brings access to them. And that's why I'm very excited to be here and be able to share about the project.
How about you, Dr. Tamoria?
Well, I've been a family doctor for 20 years and have had the opportunity to work both here in the U.S. and abroad. But before I became a doctor, I was a psychologist. And I worked with homeless youth in New York City for several years before I went to Peru to work with children who have been affected by trauma and terrorism in the 80s. Came back and decided to go to medical school, which was my dream all along, and had a great opportunity to get a National Health Scholarship Corps Award. And then I did my first service obligation in Modesto, California, and had an opportunity to work with a collaborative team of social workers, psychologists, and other kinds of peer specialists to work with children with attention deficit disorder and their parents who suffered from substance abuse and some severe mental health issues. So following that, I've worked in places like Southern Sudan and Peru with people who live in extreme poverty and have been affected by many other kinds of social determinants of health. And I feel gratified to come back to Kalihi, where I first started when I came back, I lived in the 60s in Kalihi.
Wow.
And my first day of medical school was at Kalihi Palama Health Center. And so when I was offered the position to be working in transformation of health and leadership, I was really honored. And it's a great opportunity to work with Living Well because it's the whole concept of healing involves mind and body, spirit. And I think we are embarking on a project for the severely mentally ill, the most vulnerable, many of whom are on the verge of homelessness or have been homeless or are homeless. And it's a great opportunity to provide integrated care so that they can have a home.
So what exactly is the Living Well Hawaii project, and how was it created, and what makes it unique?
Well, we've been talking about this for a long time. Since 2009, the Community Mental Health Centers and Kalihi Palama Health Center have been wanting to establish an integrated system of care, having behavioral health services, having primary care services in one place in a coordinated way. We applied for grants in 2009, federal grants, and again in 2011, and unfortunately we weren't awarded those grants. But the Department of Health, really thought that this was important to establish, that this would provide access to medical care to a population that normally wouldn't get medical services. And we went ahead with the project without any funding.
Wow.
And it's really unique in that it's a merger between a state-operated community mental health center with a private nonprofit agency, Kalihi Palama Health Center. It's having a primary care doctor, a doctor's office, in the mental health center. And that's a very unique and special project that is the first time that we've done for our adults, mentally ill adults.
In Hawaii.
In Hawaii.
Well, let's take a look at a news clip provided by KGMB that highlights the open house of the Living Well Hawaii project.
Welcome back. A new concept in community health clinics opened in Kalihi today.
It combines medical and mental care under one roof. Tanya Joaquin has a first look. Tanya?
Steph Keahi, recent statistics show close to 32,000 adults and 12,000 children in Hawaii have serious mental health problems. The state has high hopes for a hybrid clinic that provides behavioral and medical services in the same setting.
A chant and untying a Miley Lei blessed the opening of the state's first Living Well Hawaii Project clinic. Right now, it's one exam room at the Lanakila Health Center, but as needs expand, so could this healthcare model, combining behavioral and physical services under the same roof.
Persons with a severe and persistent mental illness like schizophrenia or bipolar disorder or recurrent major depressive disorder, we do know that they die 20 to 25 years earlier than the normal population.
Governor Neil Abercrombie says this is the direction the state needs to head to serve those suffering in silence with aloha.
Even though they may be in literally the same space that you are in, that they themselves are lost.
Kalihi Palama Healthcare Center and community mental health providers will work together here to help residents address behavioral health problems.
Those with behavioral health issues oftentimes find difficulty getting employed, and then that leads them into issues related to poverty, homelessness, but we must look at the entire person.
The hope is to take this hybrid healthcare approach and replicate it around the state.
The Living Well Hawaii project is more than a healthy mind and body. It is the living, breathing example of what our values in Hawaii are all about.
They live longer, and more importantly, they get the kind of care that they need, and it doesn't, the costs of it aren't sky high.
In fact, quite the opposite. The cost to get this off the ground, relatively small, with $20,000 investment. The health department plans to study what works, what doesn't, and then take this concept statewide. Tanya Joaquin, Hawaii News Now.
That must have been so nice to have the governor and the director of health there to share that moment. Now, health equity is a big topic these days, and it's also one of the foundations of the Department of Health's strategic plan found in this booklet. And the goal is to eliminate health disparities and provide healthcare access to all groups throughout the state. Can you describe how the Living Well Hawaii project has aided in that effort towards health equity in Hawaii?
Well, our severely mentally ill clients, they die 20 to 25 years younger, than the rest of the population. That's a national statistic as well. These are individuals who have really a lot of difficulty accessing medical care. It's hard for them to go to a doctor's office, sit in a waiting room, and have to get their blood work taken, have to go to get x-rays or ultrasounds, and even to get transportation to these doctor's offices is challenging. They're facing a number of other issues, whether it's homelessness or legal problems as well. So bringing those services to them in a mental health clinic where they already have an established relationship, maybe with their psychiatric team, you know, it really benefits them in so many ways.
Could you elaborate a little bit more about the populations you serve, and why was Kalihi-Palama chosen for this pilot project?
The Kalihi-Palama area serves a high immigrant population. It's also a very low income population. And we have the homeless shelters in our area, we have the prison nearby as well. And Kalihi-Palama Health Center particularly has a lot of culturally sensitive approaches, as well as having interpreters available. Both of our agencies have interpreters because of the population that we serve.
Wow.
In fact, Kalihi-Palama Health Center has 17 different languages provided by our interpreters. And we serve 21,000 patients without regard to ability to pay. And so this is really a unique opportunity to have a partnership so that we can eliminate disparities that keep people from getting access to proper care. So often, the severely mentally ill may go to their psychiatrist or may not. They may not want medicines, and they'll go to their primary care specialists.
I see.
And so this time we're all in the same house.
All under one roof.
That's right.
Yeah, it's fascinating because the U.S. system, some might even call it fragmented, because those with both mental health care needs and physical health care needs, sometimes they might have to choose which takes priority, which needs they have to get care for. And so that makes this project really important. And so in light of the healthcare transformation going on in Hawaii, how would you say that the Living Well Hawaii project has transformed healthcare for the severely mental ill?
The patient-centered health home approach has shown to have positive outcomes nationwide. And what we are saying when we're saying person-centered or patient-centered is that we're starting with their goals. What do they want to achieve, whether it's for their mental health or their physical health. And it really is identifying what motivates them so that they're active participants in their care.
That's great. It's not, you know, business as usual, where if I were to go to the doctor and they would say, Lauren, you have to lay off the sugars, no more salts. It's more, what are your goals and how can we tailor this care to help you accomplish those goals?
Exactly.
In fact, when we first started the program, we thought we would get to know each other. And so we would just have like these meetings where we just get to know the patients. And in one of those patients happened to be a Japanese American male who had schizophrenia since he was an adolescent. And he said he was feeling great. He had a little sour stomach, but we noticed that he hadn't had labs done in about 6 months. So we encouraged him to do that, and come to find out, he was on the verge of being one of those casualties. And if he had not gone in the intervention of the emergency room and then subsequently the ICU, he would have probably passed away in his sleep. He was near dialysis and he had a very severe pancreatitis. So he recovered completely, and now he's our star Living Well patient. And he goes around, he's our greatest advertisement. And he goes around saying, join the Living Well, enroll, because it saved my life. And that is gratifying for us to hear, and to really see that it wasn't just our care, it was everybody working together. And us working together, and then he came back and said, now I'm going to change my diet, I'm going to exercise, and I'm going to visit the dietitian, the diabetic care specialist, and we hope that he continues.
What an amazing story. It's so important to have that communication between the primary care physicians and the psychiatrists, because you don't want to disconnect, and you might have conflicting medicines, and that can cause all sorts of problems. I have another question. Who is eligible for the Living Well Hawaii project? Do you have to be enrolled in Kalihi-Palama Medical Health Center?
Well, currently you have to be a client of the Kalihi-Palama Community Mental Health Center. And you have to have one of 5 chronic conditions which we're targeting.
I see.
So that's obesity, tobacco use, high cholesterol, high blood pressure, and diabetes. And I would say 80 to 90% of our clients already have at least one of those, and a lot of them have multiple of those chronic conditions.
Wow.
Like the example Dr. Tamoria gave, he had all 5.
Wow. Yeah, that's crazy. So I think people might be wondering, how much did this project cost?
For the state, the costs were minimal. It was a cost to renovate the room and some supplies. It was under $30,000 for us to do all of that. For Kalihi-Palama Health Center, it was more because they were paying for all this medical equipment that was brought in. And so that was probably closer to about $60,000.
Wow, that's really impressive. I also heard that clients were heavily involved with the planning process of the Living Well Hawaii project. Can you talk a little bit about the collaboration that went on to make it successful?
Yeah, we were very fortunate to have a group called the Integration Advisory Group. And it was composed of individuals from Kalihi-Palama Health Center and Kalihi-Palama Mental Health Center, and facilitated by a peer specialist from the Mental Health Center, Matt Lee Davis, and co-facilitated with Chris Rocchio from the Adult Mental Health Division. And they met monthly, and they went over all our materials, from our posters to our brochures. They commented on the colors and the slogans, the wording of our materials as well, and they gave us really interesting feedback. I mean, even down to the colors of how gray reminded them of cigarette ash.
Oh, interesting.
Yeah, and how primary care doctor, they didn't know what a primary care doctor, they'd rather us use a family doctor. So, I mean, it was really helpful to hear that. It was invaluable because it's all about being client-centered, patient motivated, and to have them help drive how we enroll people into this program and how we're going to be communicating with them has been crucial.
Can you tell us a little bit more about the roles of the peer specialists? Because I think that's a really unique aspect of this project.
Peer specialists are specially trained by the Adult Mental Health Division. They have a mental illness. They serve as role models and advocates for the consumers. They give us great feedback as to how our approach in care is.
Oh, wow. That's really neat.
Yeah.
So I'm most curious to hear about how the Living Well Hawaii project has been working so far. What have been your successes and what challenges do you still face?
Well, I told you about that one success, and I think it's good to talk about another success where this young man, 27, schizophrenic from the Big Island, he went to Queens Medical Center because he had an ulcer on his foot. It was almost necrotic. But he had a very wonderful peer specialist who was with him, who followed him out because he left without getting his treatments, and he brought him to our clinic. And when we received him in the clinic, we were able to treat him for that, and eventually the social worker saw him and he got into a home.
Wow.
And the challenge about that still remains is, will this be sustainable? Because changing behaviors depends on many things. How much money you have, who's supporting you. And so we hope that we will discover what are the other needs, but also help in the process of the healing that is actually probably at deeper levels. And it's always a process, it's a daily process, and sometimes it's invisible. And so it's going to be a challenge sustaining and continuing to be creative in meeting their needs. And them leading us in finding what will work for them.
And garnering trust. And so are there any plans to extend the Living Well Hawaii project to other locations?
Yes, we're talking about establishing another Living Well Hawaii clinic in Pearl City, located at the Central Oahu Community Mental Health Center, and again in collaboration with Kalihi-Palama Health Center.
Oh, that's exciting. I wish you the best of luck. Do you folks have any final thoughts that you'd like to share with us before we wrap up?
Well, I'm really excited about this project because, You know, a lot of times the clients who come to our mental health center, they wait until the situation is urgent or dire to get medical attention. And even then, follow-up has been a challenge as well.
Yeah.
So having access to this kind of medical care right away and in a coordinated way, you know, it helps them tremendously. And I anticipate really great outcomes as a result.
I think it's fabulous that all needs are met under one roof. How about you, Dr. Tamoria? What would you like to close with?
And I think that a patient-centered medical home is a real challenge to provide, but it's also about what Hawaii is. And with our problems with homelessness, we have an opportunity to provide a medical home where we can have integrated behavioral health and primary care, and the opportunity to eventually transition everyone into their own home and to enjoy the fruits of the earth, our clean and sustainable environment.
Well, thank you so much for joining us today. I learned a lot about the Living Well Hawaii project, and I wish you the best of luck, and I hope to hear from you again soon about how it's going.
Thank you
Thank
very
you.
much.
Thanks for joining us for another episode of Foundations for Healthy Generations. Until next time, be well and ahui ho.
It's a beautiful day. Lucky that we live Hawaii. 24/7, 365. Swimming in the ocean anytime.